If I can choose to get a boob job, I feel like I should be able to choose to have my baby by cesarean.
Adding that there are some hospitals she won't even work with because OBGYNs are too quick to cut.
Show me the proof. The least qualified professionals are delivering outside of the hospital, and the least complicated patients are delivering with highly skilled surgeons. We will never have C-section rates like that in the United States with capitalist healthcare. This one is an interesting headline that caught my eye, and I want to go through it because when I read it, my first thought is, right, we need to look at this study because I know how different media outlets present everything. This headline is, researchers warn planned C-section births, the most common surgery in the US, can increase risk of childhood cancers. 1 in 3 women in the US has a C-section to give birth. All right, so I want to know so much about how they gathered this data. So let's just go through. I hope what you can get from this segment of us talking about this is a better understanding of when you see a headline that grabs your attention, how to go through the process of working out if maybe there are some exaggerations going on statistically that aren't lies, they are important, but maybe is presented in a way that's not the most, how do you say it, honest? Because don't forget, everywhere you see things like this posted, they are making money for clicks and they need you to click it. All right.
New data from the Centers for Disease Control revealed the number of C-section births in D.C. and Maryland is higher than what we're seeing nationally.
And Fox 5's Homa Bash is live tonight taking a closer look at all those numbers and has a report for us tonight. Homa?
Hey guys, good evening. Yeah, these numbers show that the rate of C-sections has actually increased nationwide. 1 in 3 babies in the U.S. now born by surgery, and some experts say it might be time to take a step back.
Okay, if you actually talk to experts, I suspect that that's not exactly what they say. As an expert myself, it might be time to take a step back is not how I would present that. You can't just change the C-section rate by snapping your fingers. And I will also say that that is quite similar to the C-section rate of almost every developed nation.
The adorable clothes, the tiny shoes, little baby things can be so cute. But let's rewind back to how they're born first. New data from the Centers for Disease Control shows C-section births have increased across the United States, now at 32.4%. For mothers in Maryland, that number was higher than the national average at 35%. Same in D.C., 34.1%. Jennifer Winters is one of those moms.
It was actually a planned C-section. Alexander, my 18-month-old, was breech, and
Okay, so see, they've already said we need to take a step back, but then the first person they interview is someone whose baby was breech, and that's like a really valid indicated reason to have a C-section, right? You can't just take a step back and stop paying attention to the data on outcomes and stop doing planned cesareans.
I did everything I could to possibly turn him around. Unfortunately, it was just a planned C-section. It actually was fantastic.
The CDC report indicates 2023 saw the highest number of cesarean deliveries since 2013.
Since 2013. Okay, interesting. So maybe in this article, we'll be able to see actual data to assess that. But when I'm listening to this story, the first thing that stands out is, 1, why are we presenting C-sections as bad and then talking to someone who had a very indicated C-section? And 2, what is the trend over time before 2013, from 2013 to now, and over the past 2 years? Do we just not have data on that yet? Or are we referencing 2023, a year that was 2 years ago, because actually now it's come back down to the level that it was at? Does that make sense? These are the things I think about.
Let's take a closer look at the numbers. Out of more than 65,000 babies born in Maryland last year and nearly 8,000 in the district, nearly 30% were low-risk C-sections.
What does that mean, and where does this data come from? What is a low-risk C-section?
Just over 26% of the 92,000 Virginia babies were low-risk C-sections as well. All of it much higher than the World Health Organization's ideal cesarean rate.
Okay, yeah. We can talk about the ideal cesarean rate of 10 to 15%. Unfortunately, that is a near impossible number to achieve when you work within a system like the United States that has such a high medical legal culture. We will never have C-section rates like that in the United States with capitalist healthcare. And not only capitalist healthcare, but the litigation happy culture of the U.S.
10 to 15%. Malika Hook Mohammed runs the DC doula, helping deliver babies for the last 18 years.
The more easily this trend is being accepted, the more it will be offered.
See, I don't like it when people talk about it like that, because what data do we have that this is based on purely elective unindicated C-sections? Like that, what they imply is like the more that we accept it, the more it will be offered. Hang on. Are we actually seeing changes in C-section rates because of more people having elective primary sections for no real reason other than they just want it? Or is there other things going on, like repeat C-sections and people don't want to VBAC, or like a combination of those? And also, even if it is just elective C-sections, I want a C-section. If I can choose to get a boob job, I feel like I should be able to choose to have my baby by cesarean. It needs to be a risk-benefit discussion, absolutely 100%. But like, there is autonomy in this, and people have agency, and we can't just start saying, no, you have to have a normal delivery. That's your only option. I'm not even going to hear you out. Like, that's crazy. And also, most people don't want to have a major abdominal surgery. I don't think that's the reason for changes in rates of cesarean, personally.
Of patients being educated about their...
Actually, I know it's not, but I'm pointing out things that you should listen for and what should go through your head as a consumer of health and science information that is broadcast from media.
And providers being open to those options. Adding that there are some hospitals she won't even work with because OBGYNs are too quick to cut.
Some providers in some hospitals, all they do is surgical birth.
Show me the proof. There are OBGYNs working as obstetricians who refuse to do anything but surgical births. I have a hard time believing that. This is another point too, and I see this come up in like parenting forums, Facebook stuff a lot. People saying like, oh, I don't use that hospital. Their cesarean rate is 45% or whatever, and that one's better because it's 20%. That tells you nothing. Same for doctors. Like, you can't look at an individual doctor's rate of cesarean and decide that person is better or worse, because we need to be asking why the disparity. Is that hospital or that doctor taking care of patients who are much higher risk? Is that practice's set up such that that doctor doesn't actually even deliver babies? They just do scheduled cesarean lists in the operating room, like that's their job. In which case, yeah, your C-section rate would be 100% because those are the only births that you do, and other people in your practice go to the vaginal deliveries. Like, there's so many questions that go into this. Like, you can't just compare one to one. You will never get the answer that you're trying to get by doing that.
So when you deal with a provider where surgery is their expertise, they may feel less comfortable sitting with a person that is in labor and needing to navigate or troubleshoot what is happening with the baby.
Right. So kind of. I 100% agree that the model we have in the US where surgical specialists, obstetricians, are also the only ones taking care of low-risk people who are pregnant is a setup for some of what she's saying. And that's why, like, I think the model in New Zealand is much better. Everybody has a midwife, and midwife stays with you through the pregnancy and the birth, even if you end up needing a C-section, even if you started as a home birth and you decide to come into the hospital, even if you start as an unmedicated birth and you decide to get an epidural. The midwife that you know stays with you. And this is really helpful in both decision-making, understanding the process, and feeling supported and safe. But also, you're right, we don't need low-risk people being taken care of by obstetricians. We didn't make the system. Give us some midwifery regulation at a federal level. Go watch my video on midwives if you'd like to see what I mean by that. And let us have safe practice setups where our midwives can deliver in the hospital and get privileges and come with their patient and not have to hand over care just because the patient decided they want to come in and get an epidural. Give us a better system where we can work with midwives who are wonderful. I love working with the midwives here. It's just not the same in the US. There are wonderful midwives in the US. I used to work with some at the hospital that I worked at before I came here. But the way that midwife training happens, it's inconsistent. And in the US, we have set it up where the least qualified professionals are delivering outside of the hospital, and the least complicated patients are delivering with highly skilled surgeons. It doesn't make any sense. And I agree, that is definitely not better for anybody involved.
All right, so the question is, why are the rates in Maryland and DC higher? There are a few factors here. No one I talked to specifically could tell me tonight why that is, but anecdotally, experts I spoke with say it might simply be because people in our region are so scheduled. They want to have a plan, and if you're
I highly doubt anyone who delivers babies thinks that. I don't think that Maryland and DC have a marginally higher cesarean rate because people are scheduled, they want to schedule elective C-sections. So in order to know if what she's saying has any truth to it, you would have to be able to see how many of those were specifically on maternal request. No prior C-section, no breech, just a elective, I just want a C-section, and compare those rates. We don't have that data. More likely, I would say, is you're dealing with a population who is going to be higher risk, living in an urban area where they may have access to healthcare, but everything is more expensive and they may not have insurance. So what are we looking at? Is it an access problem? Is it a culture problem? Probably not. It's hard to create a culture in an entire state. I think it's multifactorial, but I think we're focusing on the wrong thing here, y'all.
Parent, you can make all the plans you want, but babies come with their own, guys.
That's also so condescending. Like, yeah, we know. We know that babies come with their own plans. Like, I hate this reductive reasoning. Children born using planned cesarean section procedures may have a heightened risk of developing certain childhood cancers, according to researchers. Okay, this is a really, really good, like, massive pregnancy registry that gives us a lot of data that's really helpful. And I'll have to click on it and see where the article actually originates. But if it is the group of Sweden maternal registry that I'm thinking of, that we've seen all the information from other studies come out, it is a very good database. So a higher risk of developing certain childhood cancers. They're going to go on to say that it's related to probably a type of leukemia or blood cancer. So after they have 2.5 million children. They're still working to figure, acute lymphoblastic leukemia, working to figure out why the kids who fall into the born by planned cesarean group have a higher rate than kids born by vaginal delivery or, importantly, emergency cesarean. Now, we're also going to need to talk about what qualifies as each of those, because sometimes people think of emergency cesarean as being like, oh, this pants on fire emergency. And sometimes it certainly is. But a lot more often, what we document as an emergency cesarean is I had a C-section before and I came in and my water had broken and now I'm having a C-section again. Like, you just came in and had a planned cesarean, but not at the time it was originally planned for whatever reason. It might not have been a true emergency. So they're still working to figure out why it's the case, but they are theorizing in this article and maybe in the actual published article as well, I haven't read it yet, that this has to do with exposure to vaginal bacteria, which creates a gut microbiome. And we do have lots of data on that. There is data on that. We don't know how it applies clinically, like what difference does it actually make, but we do know there are differences in gut microbiomes of babies depending on how they were born. My understanding, based on what I've read about it previously, was that this resolved fairly quickly, like as you got into the world and life, but I could be wrong. I have trouble reasoning how, if it is a temporary difference, that it would be the cause. So when you're reading things like this, your first thought should be, is this actually data that's being presented authentically and clearly and with the nuance needed? And let us not forget that correlation is not causation. C-sections are an important and life-saving part of obstetric care. We don't want mothers to feel anxious about medically indicated C-sections, but when this result is combined with other study results showing that the risk of later asthma, allergies, or type 1 diabetes increases in children born by planned C-section, there is reason to discuss C-sections that are not medically indicated. Okay, that comment, that is what I'm talking about. A planned C-section is not the same thing as a C-section that's not medically indicated. Like, this is going to break my brain. I hate, you shouldn't be researching this if you're going to say planned C-sections are the same as not medically indicated C-sections. Planned C-section can still be very medically indicated. And also, people have autonomy and agency. And like, if you have like a severe fear of labor and birth and you have a scheduled elective cesarean just on request, is that not medically indicated? Like, and there are plenty of emergency C-sections that we could argue amongst ourselves as obstetricians which ones were actually medically indicated and which weren't. Like, if I'm having a planned cesarean because I'm pregnant with quintuplets, that is still an indicated, medically indicated cesarean, but it's planned. Like, I hate how this is presented already. So they found that they have 376 kids that they look at, which is awesome. Like, I mean, awesome as in they have a large number of people in the study. And then they looked at C-sections 1982 to 1989 and 1999 to 2015. The risk of ALL was 21% higher in children born by planned cesarean compared with children born vaginally. See how, and it would be harder to study, but I'd really like to know how those numbers differed by planned mode of delivery, not how you actually were delivered. Because think through this with me, okay? If I have planned to have a C-section because I have quintuplets, then I end up delivering by C-section. Great, okay? That's one category. What if you have somebody who planned to have a normal delivery, but they come in and all of a sudden that plan changes and they're born by cesarean? Is that going to create the same, like we can't just look at outcomes, right? We need to look at planned mode of delivery, because sometimes we plan to do a C-section and someone ends up delivering vaginally. They had a very fast labor and VBAC'd and had a baby even though they wanted a C-section because they had one before. We have people who have planned vaginal births that end up having a C-section. So some of this is maybe not, and we need to look at the actual study because they may have accounted for that, but it's interesting, okay? So they're having higher rates of B-cell acute lymphoblastic leukemia, 29% higher in those who were born by planned C-section. Increased cancer risk was more pronounced in boys than girls and in the early years of a child's life. All right, so now the question I'm asking when I read just that sentence is, right, 29% higher. That's interesting because that's not that, it sounds like a lot, and it might be, but it's highly dependent on how many people actually get diagnosed with this, right? Because, sorry, that's my take some melatonin and start calming down alarm, but sorry, I'm working. 29% higher if we're talking about something really common is a lot, but 29% higher if we're talking about something that is really rare is not necessarily that much. I relate it back to like when we're talking about birth control and people talk about Yaz and how you have 100 or 200% higher or double or triple risk of having a blood clot, which is true, but I always like to bring it back and reframe relative versus absolute risk, right? So if it's only 1 in 10,000 people get a blood clot on birth control, it's actually probably closer to like 3 on combined hormonal contraceptives, but 6 in 10,000 have that happen on a particular type of contraception. Well, yeah, that is a doubled risk. You're going to see it presented in articles like this as a whole lot higher, twice the risk. And it is technically, but your relative risk is so low that your actual risk of that happening is still incredibly small. Does that make sense? So ALL is a blood and bone marrow cancer. It's the most common type of cancer in children. Okay, so that's helpful. That answers one of those questions. It's unclear what causes the DNA mutations that lead to the cancer, but treatment result is, so it's a highly treatable leukemia. The American Cancer Society estimates 6,000 new cases and 1,400 deaths this year. That is still quite a bit of deaths. But again, that is not a wildly crazy high number if you take into account how many people there are in the US in general. The excess risk associated with planned C-sections corresponds to approximately 1 case of B-cell acute lymphoblastic leukemia annually. The excess risk associated with planned cesareans corresponds to approximately 1 case annually. Okay. Right. This is all we need. We can go open the original article if we want, but really this is all we need, okay? So in the United States every year, there are, I couldn't even begin to like make a guess, a whole lot of cesareans. So if we're saying that 1 case of leukemia might be correlated to mode of delivery annually in the US or not, I don't know if it's the US or everywhere, regardless, 1 case, like that is, you're writing a media article that headlines essentially saying your kid's risk of cancer is way higher if you have a planned C-section. And it might be true statistically, but it amounts to a correlation of 1 case in a year. Not that that one person doesn't matter, but that's important data points, right? Like this is being presented in a really alarming fashion for something that is, quite frankly, possibly correlated and not caused, and 1 case per year that might be attributed. That's a real hard sell for me to say that we need to be saying headlines like this, terrifying people for no reason. Okay, C-sections have become increasingly common in the US, accounting for about 1 in 3 births. Over what time frame have they become increasingly more common? Let's look up. Why don't we look up that data? Right, okay. So this is not really the graph I was actually specifically looking for, but this is helpful as it is. because if you look at this in these years, right? So there's a sharp rise in cesarean rates leading up to the mid-1980s. This makes sense because it became a lot more accessible and safe to have a cesarean, and we were balancing perinatal mortality. So you can see here this drastic drop in perinatal mortality, meaning bad outcomes for babies, well, death for babies. And that, again, we can't say C-sections caused that to decrease, but there's certainly a strong correlation there. And then we have it kind of plateauing for a little while. And then in the early 2000s, we see this big increase leading up to 2008. We're at 35% by the time we get to, well, 33% by the time we get to 2008, 2010. And from then till 2017, we're pretty stagnant. And I would say, based on what we just read, that 1 in 3 is 33%. So has there actually been a sharp increase in cesareans in the past 15 years? I'm not really sure that the data supports that, if this is accurate, and it's CDC data. So does that make sense what I'm saying? So I'm not, it's technically accurate to say C-sections have become increasingly common in the US if we're going to compare it to 1985. But like, that's before I was born. And now I'm the one that does the C-sections. Like in the past 10 or 15 years, it's been fairly stable at around 1 in 3. Is that too high? We can argue that till we turn red in the face like me flushing because of these lights, but I don't know that it actually is a transparent way to present this information. There are 1.2 million C-sections performed every year, making it the most common major surgery performed in the United States. Okay, true, but I don't know what to say to that. Like, they keep presenting things as negative when they could be neutral. Let's go back and do a little clicky through some of these. This one is specifically interesting because if the rates of autism diagnosis have gone up a lot, which we know they have for many reasons, and the risk of cesarean has gone up, which we know they have for many reasons, those two things going up together don't necessarily mean that C-sections cause autism, right? It's the same with the Tylenol discussion. Thank you, Donald Trump. It's just, I hate how the media presents this stuff. So we're not reading that because I'm gonna have the same tangents that I'm angry about. So I am allergic to everything, but right now I'm allergic to people who utilize statistics to prove their point and get clicks on the internet. It makes me mad. Ugh. I want to see the actual study. We observed an increased ALL risk among children delivered by planned C-section. Births, 2.4 million. Vaginal, 2 million. Cesarean, 375,000. All right, results. So, risk. Vaginal versus C-section. It is not very different. Number of cases. Okay, so we just looked at the crazy amount of births that they had evaluated, right? So it was like 2 million vaginal and 375,000 cesarean. And the total number of cases was 1,000 in the vaginal group and 184 in the C-section group. So do you see how small these numbers are compared to how many births they had looked at? That should spark your interest as well. It doesn't mean the data's not right. The data's right, and this is a good study. It means that the way the media presents it does not give us the whole picture of how we should interpret what it is saying. And hopefully they're more measured in the actual scientific publication discussion than the media isn't presenting it, because that's part of our job. A recent meta-analysis found that children delivered by planned cesarean had an 18% increased risk of developing ALL compared to those born vaginally. So that's interesting. What is the absolute risk though? And I'm not saying it doesn't matter. I'm saying it matters how we talk about it, because we don't want people being afraid to have their baby by C-section if the risk of, I don't know, mortality related to something going on that you need a C-section for is higher than the risk of this, right? A largely curable cancer. Nobody wants to get like leukemia, right? But like if more babies would die by not doing some C-sections, then a smaller amount getting a cancer that probably won't kill them is better, right? So, and like we don't know, it's correlation, so it's hard, but is how I'm reasoning through this making any sense at all? So the risk here being 1.07 that's not a huge difference, but there is something about that specific type of cancer. Interesting. I don't know. So Again, I didn't go through this to answer the question of do C-sections cause leukemia by changing the microbiome? I don't know, neither do they. But what I can say is correlation is not always causation, and absolute risk, like your risk of this happening in general versus relative risk, your risk of it happening if we're comparing C-section versus vaginal delivery, is important to the discussion. Hopefully that all makes sense. I'm just trying to give you kind of a really detailed overview of how, when I'm reading an article that sounds a bit clickbaity from the media, what's going through my head as I work through the process of trying to understand it.